is Julie and Julia back with you. Today we're going to talk about a couple of different topics with human trafficking. We're going to cover a little bit on each subject. So we're going to talk about familial trafficking, addictions, and health risks associated with sex trafficking. So the definition for familial trafficking, and pardon me while I read it off my paper, but I don't have this one memorized. It involves the exploitation of a minor within their own family for goods, substances, services, or money. While parents are often the perpetrators, any legal guardian or family member, including aunts, uncles, cousins, grandparents, or siblings, can be involved. And this definition comes from inhope.org. 40% of all trafficking cases are perpetuated by family members, and that is an alarming rate. But when you think about it, and as we go throughout this discussion, you'll realize why that happens.
Traffickers begin grooming the victim at an early age using their close proximity to take advantage of their child's developmental stage. According to the U.S. Department of State, familiar trafficking is difficult to identify because many of the children are under 12 when it starts, so they may not realize they're victims.
Yeah, so I would say that that's probably in most of the cases that they don't realize it's something that's happening. Power and control is already established with the child and the person in authority. So think about people in your life in authority. So if you're a child, your mom, your grandmom, they would only have to look at you and give you the look to make you get yourself in order. So with trafficking, that same element is in effect. And so children know that they need to obey those that are in authority above them. So they're going to do what they ask them to do because they don't want to have the consequences of not obeying their parents. It's underreported due to the complexity of family dynamics. So if you think about that, children are threatened or even guilted by family members not to tell the family secrets. So we see that a lot in sexual abuse of children, of physical abuse. So, they're telling them, you better not tell anybody that this is happening. And they know that the result won't be good. So they're even threatening them and guilting them into thinking that if they tell, then they'll be responsible for tearing the family apart. And what child wants to have that on their conscience? I can't think of any.
And some other common power and control tactics that they use, some that she already mentioned, physical abuse. So sometimes they'll deny them food to keep like as a punishment, like, oh, you didn't listen to what I told you to do, so now you can't eat. So isolation, they keep the child confined and they cause them to distrust people. So like the police and like people that can help them, they'll cause them to have this like fear in the way of them. And then like Miss Julie said, blaming. So they'll blame the victim for what's going on, and if they tell somebody, then they'll be tearing their family apart.
Yeah, so you think about like entities that would be there to help the family, like social services or health department, places like that, the doctor's office. They may even lie about how they acquired bruises or, if somebody else in the family got hurt, they would lie for their mom or dad or anybody that's in authority in the home to keep them from getting in trouble too. So it really is just a cover up. And we see this a lot, especially in families where sexual abuse is happening for children, where, there's an uncle, quote unquote, that's taking care of the family, but he's also touching the children. And they're told not to tell anybody that that's happening because he helps to pay our bills and just kind of brushes it away and sweeps it under the rug so that people don't know what's really going on. And I think that it's happening more than we realize. In a lot of places, that's what's the common thing that's happening and the norm for that family. So they see it happening with other people, so they just go along with it because they don't want to be the one that is cutting off the funding that's coming into the family by that person, or even destroying the family and pulling it apart. Okay, so then we're going to talk about addictions. Okay. So traffickers will either use a person's addiction to exploit them, or they will force the person to use drugs while they're being exploited. Victims will often use drugs and alcohol as a coping mechanism or a way to escape the reality of what's happening to them. You have something on that?
Um, yes, so when someone is addicted, their brain and their body is chemically dependent on a substance, so it makes them more vulnerable to the trafficking and manipulation. That is,
So traffickers have withheld drugs to force the person to do what they're asking them to do. And someone who's addicted is willing to do whatever it takes to get that next high because they don't want to be dope sick. So traffickers will use that to continue to exploit them. And then now we're going to talk about the health risks and health situations that are associated with trafficking.
so, according to a study done by Beasley Institute for Health Law and Policy, it was a group of 66 human trafficking survivors that they found that between all of them, they had a total of 114 abortions. So some of those abortions were done like with most of those abortions were done with coercion and like forcing them to have the abortion. And even some cases like they'll have the woman like keep the child to have them like emotionally attached or just in a way of um, like power and control. So they'll provide for that child and all the things, but just to keep them in that loop of trafficking.
Yeah, so you think about that. How many traffickers use abortion as a means of birth control? A lot of times, traffickers, they don't want them to use the men to use condoms, so that that they're getting the best experience. But then that's putting the person at risk of so many health concerns. But abortion is one of them. So I would really like to have a broader look at how many people have experienced abortion as a result of trafficking. There was a couple of things that I learned about this. That one of the pregnancy centers that we've done some training with, um, they told me that they thought that there was a trafficker who was bringing women in to get tested. So this guy would bring in several women, and they were the same guy bringing in different women, and they were getting pregnancy tests. So, making sure that they aren't pregnant. But in the case that they were, what was the next step? We've been told by women who've been exploited that they, were that's an issue, is that abortion is the means of taking care of the pregnancy. Because you don't see very many cases where a woman is having her child in these situations. I think that if someone decided to do that, it would be, a difficult situation for that child to be raised in. Another pregnancy center told me that they see people that wait outside of the clinic, the pregnancy center, and then they're next to a methadone clinic. So traffickers will prey on people that have addictions as an issue, and also people that are, pregnant, and maybe they're the ones that sent them in to get the pregnancy test, but they've seen this happen at their establishment. So I think this is an issue that we need to learn more about and find out how we can be a help in that situation, because it's just, they think it's a quick fix in the moment, but the effects of an abortion will stay with a woman for many years after it's done. You never forget that life that was inside of you and that was cut short because someone forced you to get an abortion. So, other health concerns Julia's going to talk about.
So some other health concerns are STIs and STDs. So if those are not getting like treated, they can have a long-lasting effect. They can cause infertility and just other bad health problems. And um, some other ones are infections or mutilations because it was done unsanitary or with a doctor that was supposed to get rid of the child. And then malnourishment and dental problems that occur. and even lower back issues due to abuse. So like if they're abusing them or torturing them, they're not going to do it in places that are really obvious because they don't want it to draw attention. So they'll like cause pain to the lower back to hide that that they're doing that. So yeah, and then psychological trauma forms from the daily mental abuse. So um, some cases, like some psychological abuse or like mental health issues that occur are anxiety, depression, schizophrenia, PTSD, and sometimes the trafficker can try to manipulate that diagnosis. Like though there was an example of a lady who went to the hospital with her so-called brother, but it was really her trafficker, and they she was there because of an issue that occurred, so she needed medical help. And the trafficker, her brother, was trying to tell the doctors like, oh, she has schizophrenia and she's delusional and all these things. And it turned out that really she was in a trafficking situation and he was trafficking her. And
He wanted to make her look like she was had mental health issues, but really it was as a result of what was going on. He was trying to hide the situation. So what we see too is the body will hold on to trauma and affects different parts of our bodies as a result of that. So if somebody is being exploited, you have to think about trauma. So trauma, we all experience trauma. There might be a situation that we went through, maybe a car accident or the loss of a loved one, or parents got divorced, or something like that. That's one event that causes trauma that can have long lasting events. But if you think about complex trauma and the life of a survivor, if someone is being exploited 7 to 10 times a day, 7 days a week, that's going to lead to complex trauma because you have trauma on top of trauma on top of trauma on top of trauma on top of trauma. So that's trauma that is going to be really difficult to be able to heal from. So with our program, we have them, the women that we serve, go to a therapist that has experience working with trauma survivors. So it is important when women have that way out that they get the proper care that they need in order to work through all the things that they've experienced. Often they'll need to see a chiropractor or someone else that can help them with those um, bodily issues that are associated with the trauma that they endured. So it might not be that they were physically hurt or harmed, but the trauma does take effect in the body, and you can read about that from the book, The Body Keeps the Score. So thank you again for doing your research and being willing to learn more about the issue of human trafficking and being with us today so that we can share about the things that people will experience in those situations. So this is our final Teaching Tuesday in the month of January. Who knows, we might extend it into the next few months and decide to jump on here a couple of times to be able to give you more information as we delve deeper into the topic of human trafficking. So Harriet's House is here to serve in whatever way you need. Our drop-in center is open again. So you can come in on Mondays and Tuesdays at 900 Peach Blossom Avenue in Cambridge to receive different resources that we have. And then we can get you connected to other resources in the community if we don't have what you need. So thanks again, and we'll see you next time.